Hello guys, this is Brian here with a video. Today is Thursday, October the 11th, 2018. And this is a video what took place for my spinal cord stimulator and things like that in my experience. Uh, a person commented on my video that I was letting you know that the insurance company did approve, and they were asking, I think she said her husband's going to have it done too, what to expect and things like that. So I decided to make a video. Now, I'm not for sure why I didn't make a video during the trial. I guess it really just slipped in my mind and really and didn't think about it. I did have the temporary device and the leads removed today, which the device is just taped to your back. I'm gonna see if I think I have a picture of that, and the leads were taken out today. My trial was around 8 days because it started last Wednesday. I guess it varies from patient to patient and when the doctor can get you in and things like that. Sometimes it's 5 days, sometimes it's 10. I would think going beyond 7 days, it really starts getting on your nerves because the medical tape. So let me go ahead and tell you about my experience, what took place. Now, everybody's experiences may be different. Different manufacturers do different things, and different doctors' offices do different things as well. In my particular case, my spine doctor and pain management doctor kind of recommended a spinal cord stimulator over a lumbar fusion because that's a god awful surgery. And at first, I didn't take the spine doctor really seriously at first. I thought, well, hell, let's just do the surgery and fix it. Fix the underlying problem. Well, I did some research, and of course, I talked to the pain management doctor and lumbar fusion surgery because for me, they had to go through the abdomen. It's going to be hell and very invasive, basically. So I went ahead and seen my pain management doctor. Now, here in Texas, I don't know about other states. I'm assuming it's also is just really common, but usually there's only two types of doctors that does the spinal cord stimulator. Either a neurosurgeon, which is the spine doctor, or a pain management doctor. Now, where I live, most of the time, the spine doctor would do the actual trial, then the pain management doctor will go ahead and do the implantation. And that's how my spine doctor kind of does his. Because he also has a pain management doctor in his practice. They share the same building. But I kind of thought that was a little bit too complicated to get two doctors involved and all that crap. And you need to talk to people who had spinal cord stimulators, see if it works for them. Ask questions. And most insurance companies, Blue Cross changed this, and I just noticed it not too long ago. But most of the time, 99.9% of the time, you will have to have a psychological exam done in order to see if the spinal cord stimulator works for you. I don't know why that is. I don't know if they're looking for people who have severe depression or if they're looking for people who abuse pain medicine. I don't know what the reasoning behind that is. Blue Cross did require that earlier this year, but I noticed they took that requirement out of the picture. But most doctors still require that psychological exam. And I guess they are trying to rule out depression and things like that, and how you feel about something being implanted with you. But other than that, I really don't know why. I mean, they don't have psychological exams for people who need pacemakers. I mean, so I don't know. I really don't know. So that's the first step. You have to get a psychological exam. Once that's completed, get your copy. Always get copies of your medical records. That goes to the pain management doctor, and then I met with the pain management doctor again because I also had a new MRI done, back in September. And And he said, let's go ahead and try it. I think you're a good candidate for it. Let's go ahead and submit the information to the insurance company. It took them at least a week, maybe depending. I don't know officially what date they actually sent it in to the insurance company, but it's almost 2 weeks before they called me back. Uh, so it could have been a couple of days for them to get all the medical records ready. I don't know if they faxed them, mailed it, whatever the case may be. I don't know how it was submitted to the insurance company. But I got Blue Cross Blue Shield did send me a letter saying it was approved. But the doctor's office called me before they sent the letter out because I guess it's done on computer, or they could check on the status on the computer. And so they called me. They called me with the date and time and say, "Hey, do you want to come in?" I said, "Sure, I'll come in on Wednesday at the hospital." Now, in my circumstances, because I'm overweight, I had to have my procedures done in a hospital instead of an outpatient surgical center. And that kind of, I like that anyway. I have never liked surgical centers. I think because they're not really set up to handle emergencies. So, at any rate, I would recommend having it done in a hospital if you have any other medical conditions that you think that could kind of hamper things. Because, and I've been to a surgical center and they said they could not perform the procedure due to my weight. Simply because anytime they do a steroid injection, you're laying on your stomach. So if I stop breathing, they don't have the proper breathing machines to keep me breathing because they're not attached to a hospital, attached physically to a hospital. So, if you're in a hospital, they have all kinds of stuff to save you. So that kind of works out in my favor anyway. So I went ahead and arrived at the hospital Wednesday. And I met with the anesthesiologist, the pain doctor, obviously, and he was going up and down, checking out his other patients. And nurses came in and went. And then I met two guys who were from the St. Jude Medical, and Abbott owns them now, so they call Abbott reps. I've got to tell you, I made a video before I went to the doctor this morning, like 2 or 3 minute video, and I was showing you what was in my little carrying case from the Spinal Cord Stimulator trial. Has the controller and all kinds of stuff. So watch that video before you do this one. I forgot to mention that. So I met with the guys. There's two of them, but I also met with a woman. That was Monday at the doctor's office, and I'll tell you about that because normally I would not have to go to the doctor's office during the trial until the end of the trial. So I'll tell you about that. And I asked them questions. I asked them, what's the difference between rechargeable, non-rechargeable. You need to ask them how long it lasts because let me tell you something. People don't realize down the road, all because of Obamacare in the past 10 years, insurance companies keep raising deductible higher and higher and higher, and out-of-the-pocket costs keep going up and up and up and up. So do you want a device that requires a battery change every 3 to 5 years? Or do you want a device that lasts between 7 to 10 years and does not need any battery replacements? So, you got to weigh your options. So you need to kind of think about the future about that. And I also asked them this. I don't know. The research I did, no one seems to ask this question because I watched some YouTube videos. You also need to ask them this question. I thought about this before I went to the hospital. I asked them, and I asked the guy again today. I asked them, who pays for the out-of-pocket expense when the device is under warranty and it malfunctions and stops working? Or if there's a recall from the manufacturer or the FDA. Who pays for that? I should pay for that. They should. And they did tell me that they do pay for it when there's a recall or if the device malfunctions. The guy said over his 13 to 15 years, he hasn't seen any malfunctions. Maybe a battery may have to be replaced sooner than it needed to be done. But it also depends on the usage too. If you get the non-rechargeable one and you use it a lot, those batteries will run down eventually versus a chargeable one. Now, for those who don't know, they do have a chargeable unit You don't you don't plug anything in your skin. You just like a little circle thing that you just lay on your skin and it charges up. So I asked them questions. Now, so officially, I dealt with 3 people from Abbott, and I think the other guy was there because I guess they rotate because it also was a holiday weekend. You know, Columbus Day was Monday, so I think they were kind of rotating. But usually, my main contact was just one person. I think the other guy, I think I think he texted me on Sunday. I think that was him. So I had 3 different telephone numbers with 3 different individuals. So at first they called me twice a day or 3 times. Yeah, I think twice a day. But he asked me if it was easier for him to text me. I said, yeah, that was actually much easier. So we communicated via text a couple of times a day. So you need to feel comfortable uh, with the rep, because that rep is also, I did ask him this question, and they also will work with you when they do the actual implantation. So you got to feel comfortable with them. You got to let them know how you feel with that device. You got to be honest with them. You can't lie. I don't know why anybody would, but you got to be honest with them so they can make sure it's programmed right. Because if it is not programmed right, it may not work for you, and you wasted all the money and time and effort. So you got to be honest with them. And like I said, I don't know who wouldn't, but just be honest with them. I mean, don't say you're in severe pain and you barely have any pain with it on. That's what I'm trying to say. Um, and you also need to go into this with some expectations here. You cannot go into this expecting the device to eliminate 100% of pain. It's not going to happen. That's not the device is not designed for that. So you can't expect that. Now, maybe it does. It may eliminate up to 100% of the pain at one particular day, and the next particular day you may have 80% relief. So it's not going to be 100% pain relief every single day, every hour, every week, every month. That's what I'm trying to say. It's not going to be 100% pain-free every minute of the day, 365 days of the year. Your pain level will fluctuate like it does now. My pain level does fluctuate. It could be severe one day and the next day not severe. It just depends on the particular situation that you have. So it depends if your disc is pushing against the nerve. That also contributes to the low pain too. So you just have to go into that with that mindset, and you got to go into that mindset that a device will be implanted in you for between 3 to 10 years in your body, and you got to weigh your options, do your research, and you got to make sure if they have to do any MRI. Now, the device I'm getting is MRI compatible, but since it is a rechargeable unit, I cannot have an MRI on the spot where they doing the implantation. So therefore, they can only do the MRI on the upper body and the lower body. They just can't do the abdomen area. Now I can have a CT scan. Then on the other hand, the rechargeable one, it can have an MRI. However, sometimes, depending on, he did tell me a lot of outpatient facilities kind of push patients towards it in a hospital setting to have the MRI done because it is an implant. So you got you got to do you ask the questions about that too, because I guess the outpatient places don't want to take the liability versus what the hospital can. And plus the hospital has more up-to-date MRI versus maybe outpatient, I guess. So you got to weigh your options there too. So the 2 guys, they were with me pre-op, during the procedure, and post-op. Now, I was sedated for my procedure. I have watched some YouTube videos and did, Googling, and some people said they wasn't sedated and it was painful. To me, if you're going to have that done, you need to be sedated. Now, I do remember feeling the pulses kind of when I was during the at a certain point during the procedure, because they kind of take you out of sedation and make sure the device does work before they tape it and all that stuff. So they kind of do that before the doctor tapes everything down in the leads and everything, make sure it's in the right place and all that. So I do remember feeling the pulses, but I don't remember talking to them. So I don't remember feeling, I don't remember having a conversation with them saying, hey, I felt this, I don't feel this. So, as well, the particular device I'm getting, each manufacturer does different, different things and different models. And the model I'm getting does not feel pulses. So therefore, it does not give you that sensation of being electrocuted or shocked or TENS unit type of feeling, that weird sensation, unless you turn it up to the very highest setting. So during normal operation of the device, I don't feel nothing. I don't feel no pulses or anything like that. Because to me, that will drive somebody crazy. Like I said, it kind of feels like you get electrocuted. Or maybe when your foot's asleep, too. That's, that weird sensations on your nerves. Um, um, and there's some devices that does that constantly. And I would think that would just drive somebody absolutely crazy to me. But again, everybody's different. Um, and, and while I understand the spinal cord stimulator is supposed to disrupt the pain signals that are up in the spine going to the brain, that's why I understand. I could be wrong, but that's in kind of in layman's terms. They're supposed to disrupt the pain signals. So during the procedure, like I said, I remember feeling the pulses because they turn it up high to make sure everything's working okay before they tape everything down. They use a lot of medical tape, and it will drive you freaking crazy. Then they take you to the post-op area, and then they turn around and do the same again. They actually do the fine tuning in the post-op area when you really, when you finally come out of the sedation, you're aware what's going on. You can talk and things like that. And it was pretty cool the way he was doing it. I mean, it was like he was using a tablet. I think it was an iPad, because the carry case I had also had a small iPad, Apple iPad thing I was able to control. So the guy was testing different settings. Now, the doctor, to my understanding, the doctor cannot tell the rep how to program it. He can just recommend, hey, let's try this setting. But the doctor, well, I should not say that. The doctor does not do the programming. The rep does. Now, the doctor may say, hey, let's try this setting, see if it works, because we implanted at this particular level in the spine. So the doctor may recommend a setting or strength or whatever the case may be, but his staff, the doctor's staff, and him, they don't do the programming. The manufacturing rep does, which in my particular case was the Abbott people. So you will be sore. So when I went home, they gave me a prescription for Vicodin and Flexeril for 2 or 3 days, because you will be extremely sore. First of all, that medical tape is going to be pulled down your skin when you sit down, and then you're going to be real sore at the site where they did the leads, and it will drive you crazy, that soreness too. So immediately, you're not going to feel relief immediately, obviously. So usually they did tell me it's going to take between 3 to 5 days for anybody to notice anything. Now with me, Wednesday and Thursday I was really sore. Friday I was a little bit better. Friday morning. So Friday morning was the last time I took a muscle relaxer and pain medicine. I did take pain medicine one other time, which was Saturday. But I knew I needed that because I was going to a family function, and I knew I was going to be sitting and standing for 2 hours. So I knew I was going to be in a lot of pain because of the medical tape and all that. Still sore from the procedure. So really, the device really helped me on Friday afternoon, Friday night. That's when it started kicking in and really helped, and I noticed a difference. And like I said, the rep, you should ask them how they stay in contact with you. don't, to me, for the best experience, they need to contact you or you call them every single day. Don't go with a doctor's office or a company that don't stay in touch with you until the very end of the trial, because they have to tell you, they call you or text you at the very end. They start texting me that idea. He asks, how you doing? How's your pain level? Let's bump it up. Let's lower it. So you need to be. They have to be. The reps need to be communicating with you, and you need to tell them too. So, like I said, don't go, because I have read that online that one person, I can't forget what website it was on, um, that the manufacturer rep never contacted the person until the very end of the trial. So that's a big no-no. Um, and then Friday afternoon, Friday night was a good day. Saturday was pretty good. Now, like I said, I did take a pain pill because I knew I was going to be sitting or standing for a long period of time during a family function, and of course all that medical tape was pulling and all that, and still a little bit soreness. Now during the trial, you cannot bend, lift, or twist your body at all. You can't bend over. Now, obviously, you can't prevent that 100% by getting out of the chair or getting out of the car or anything like that, or go to the bathroom, obviously. So you don't need to be bending over and tying your shoe, basically. So don't try to bend too much. You can't take a shower. However, I was able to, because my shower head was adjustable, so the spray will be completely flat. You know how showers are at the water comes out at an angle. Mine was completely horizontal. No, is it horizontal or vertical? Just I don't know what that is. Vertical, I think. And I was able to get my front of my body wet and clean. Obviously, I try to avoid it getting back wet, so I didn't get my back wet at all. Uh, Sunday, I decided to go to Target and some other stores. So I was walking around. So you kind of have to you kind of have to do your activity, your daily activities too, to see if it works. And you gotta do some experiments, see how long you sit in the car, ride in the car for. So I was at Target for nearly 2 hours, and after a good hour, I noticed my pain was starting to increase. So I texted the guy, and he said, "Go ahead, let's bump it up," uh, and it worked. So my particular device, I have found between 50, because you can adjust the strength of the signal. So with me, between 15 to 25 was good for me. Up in the upper 20s, longer car rides, standing a long time, sitting a long time, that's when it really helped me. So I experienced at least 85 to 95% pain reduction. Um, Now also, you're still going to be you somewhat sore. Um, However, on Sunday night, the thing was beeping at me, and I couldn't figure out first because I was in the other room. Now, you don't have to carry the carrying case with you constantly. I mean, you can leave it on the desk, and like on the table in the house, or leave it in the kitchen. You can do whatever you want in the house. You just need that. You just need to carry that carry case or the controller with you when you want to see if it works for you. Like if you're gonna go walking, and if you're gonna be walking for 30 minutes, that's when you need to carry it with you, so you can adjust the profile or the settings to see if it works. So you don't have to have it attached to you constantly, but when you want to change the settings, you do it because it's via Bluetooth. Um, and I'll show you a picture. I did a video on that before I went to the doctor's office. Now Sunday night, like I said, the thing was kind of beeping at me, and I heard it in the other room. But I was like, "What the hell is that noise?" And the thing said, "Low battery, 0% left." So I texted the guy, and he said the battery went dead. He said, come by the doctor's office Monday, and Jessica, the woman, she will be there. She just changed out your battery. And I asked him, well, what causes that? He said it may have been either the battery may have not been fully charged, or it just didn't may have been loose, something like that. Because it kind of looked like two watch batteries, but it also I couldn't see the actual device on my back until today. But when they changed the battery, it looked like it had like a little battery compartment that they were able to take out and change the batteries. So so the guy's kind of thinking it may just not been fully. One of the batteries may have just not been fully charged, because they used a charging deal and it may just say it was charging. It wasn't. It could have been like that. He said normally that doesn't happen, but it was an easy fix. I mean, it's nothing I did wrong or I didn't use the device too long or anything like that. It was just one of those things, technology. So Monday morning, I went to the doctor's office, and I just saw the rep, and the doctor just came in and said hi and say how I was doing. Since I was going to be back on Thursday. So throughout the week, I did really notice a difference. It helped me a lot. I was glad to get the tape off of my back today. It drove me crazy. It's still sticky. So you gotta watch out what kind of clothing you want to wear, because that sticky stuff will go on your shirt when they peel off the tape. Well, even during I take that back. I had to go to the medical supply store because apparently I forgot to get the medical tape at the hospital because I guess we left it on the counter when we were leaving. So I did have to go to the medical supply place to get some medical tape, because it does kind of get bunched up. The tape will kind of come undone because it rubs against your shirt or pants. And then, of course, when you sit down, you get up. The tape fluctuates and it just kind of falls apart. Now, this sterile tape didn't come off. It's just it's like a big rectangle. It was like the outer tape that kind of fell off and started to come off. So everything was okay, and they did give me an antibiotic. You need to take an antibiotic when you have this done because there's wires coming out of you, obviously. Personally, like I said, I was not, because due to the medical tape, I was not able to sit comfortably upright in a chair or in the car very well. When I got in the car, I had to the car seat had to be folded back a little bit more, for me to be comfortable, because that medical tape was pulling. You got to remember when they put that on you, you're flat on your stomach, so your back is, flat. So when you bend and sit down and things like that, that pulls because, your body's moving. And plus, you do have that, the device itself didn't stick out so much, maybe, but that much, maybe. So you do notice that when you sit down. Well, with me, I did notice that. That itself didn't make me uncomfortable. It's just the medical tape did. So I went to the doctor today, and they removed the leads. Now, I took a pain pill today because I didn't know if this was going to hurt or not. The right lead, because there's two of them, the right lead, I didn't barely feel anything, but the left one, I did. It was kind of uncomfortable for like a split minute when he was pulling it out. And, of course, they put, a bandage around that particular area because, there's an opening in your skin. I don't know how big that opening is. I'm assuming very little, very small. And again, I met the manufacturer rep as well again. And we discussed our options today, and I said I'm kind of wanting to go ahead and do the rechargeable one. So let's go ahead and proceed. My doctor was in there too, and he said we all came to a conclusion that this will be a good option for me. So you got to realize it's just not going to take 100% of your pain away. With me, I was able to get at least 95% pain reduction when I was walking around the store. And that was with no pain medicine in my system. Now, with pain medicine was from the previous day, tramadol. one pill, but that it really didn't really make you goofy, or doesn't make me goofy or anything like that. Kind of just all it does is kind of make me a little bit tired. So with my particular case, they did not want me to take my pain medicine while doing the trial unless I really had to, because I told them one of my goals is not take pain medicine or muscle relaxers long term. Now, some people may have to have pain medicine long term. It just depends on your particular situation. So they wanted to see if the trial worked for me without the pain medicine masking anything, masking the pain or anything like that. Because that's kind of, he said, because he told me, the doctor and the rep kind of told me, people who do require more pain medicine, like, morphine and things like that, Vicodin, it's a twofold. People really do need that, but yet they wanted to have people to get that tapered off during the trial to see if the device makes any difference. So, it's kind of catch-22 basically. But in my particular situation, since I don't take heavy-duty narcotics, I just take Tramadol and Flexeril. No, I took that when I was discharged from the hospital. They gave me Soma. It was a Flexeril. I take Flexeril already. I don't know what the difference is in all these medicines, but of course, you do take it, for the first 2 or 3 days because you're gonna be sore, you're gonna be hurting, obviously. But they want you to taper down, or either, well, in my particular case, to stop taking pain medicine and see how long I can walk around or sit in the car or sit in the house without masking the pain with pain medicine. In my particular case, everybody's cases may be different, and everybody's doctors will be, everybody else's doctor may be different. Some people do require long-term pain medicine due to their particular medical condition or other medical conditions, so they may want you to take that pain medicine and do the trial and keep it on that pain medicine that way. But personally, you may just want to try it without pain medicine, and let me tell you why. It's getting harder, especially here in Texas, and everywhere else, I'm assuming too. It's getting harder for doctors to prescribe these drugs nowadays, because everybody's worried about the opioid epidemic that's going on, which I kind of believe the media kind of overhypes it. They do everything else. But I do know it is a real problem in this country that we have people addicted to painkillers and all this. And not necessarily their own fault. It could be the doctor could be prescribing too much and they become addicted, or they may just had a simple injury like a broken leg and they become addicted to the pain medicine. So that, that's a worry about me too. That was worrying about me. I was worried about that, and that's why they kind of told me, let's go ahead and taper down your medicine. Because you don't know. A year from now, you become addicted to something. You just don't know because tomorrow is not guaranteed, basically. Things change and things like that. But I do think the longer that you are on pain medicine, long term, because supposedly they say these drugs are not safe to be used long term. Well, okay, well, what do you do with a patient who has a bulging disc, herniated disc, or something other medical problems that causes pain, cancer, whatever the case may be? What do? You can't sit there and have a person in pain. You know, so the patients also have to be somewhat educated on what the side effects of these drugs are. Of course, when you get into coatings like Vicodin, Narco, and Oxycodone, obviously that one, those are severely addictive over long-term use. I don't think Tramadol is. Maybe people are addicted to Tramadol. To me, Tramadol is like taking maybe a a handful of aspirin. It really don't. It does not cause me to be any goofy, and doesn't cause me any kind of side effects. All it really does is make me tired. So I can take up to 2 pills, and it really, you don't get a buzz from it. Now, some people may get a buzz from taking two. It just depends on the particular person, how tall they are, and how much they weigh. Now, if I do take a Vicodin, yeah, I can't drive a car. So everybody's levels are different. Tolerances are different. Get back to the spinal cord stimulator. They say, the rep and doctors and I came to the conclusion, yeah, this is a good option. Let's go ahead and submit the information to the insurance company. So I did tell them I did want the rechargeable one, knowing that I cannot have MRI done on that particular spot. Now they can do the head and legs or wherever the case may be, but it's just not where it's implanted. Now I do have the option up to the day of the surgery in the hospital. I can tell them which device I want. They have both on hand. Now the rechargeable one, the permanent one, it does not have a device like an iPad. It's a different controller device. So I was okay with that. And you have to charge at least once a week. Now, if you use it a lot, maybe twice a week. But my particular device I'm getting, you do not feel the pulses unless you put it on the highest setting. And that was probably with me, because I was playing with it myself, it's probably between 27 to 35 strength level. That's when I was able to feel that weird, shocking, and electrocuting feeling. But you should really got to do your homework. That's what I'm trying to say, and you got to be in communications with your rep, because that rep is also going to work with me when it's implanted too. Now, the battery issue was just a fluke. It's nothing I did wrong. It's nothing what they did wrong. It may just, machine may just say it was fully charged and it wasn't. And things like that. So it's nothing that anybody really did. So you just got to do your homework. And talk to healthcare provider and see if this is a good option for you. Now, obviously, the more you use it, now, of course, the guy said, if you leave it on 35, mine was set at 35. Now, of course, I think it can go higher. But I think my particular profile, the machine can't go past 35 unless they do it on their end, I think. Now, of course, if you have it on full blast, 365 days of the year, of course, those batteries will run down faster and faster and faster. So you would have to get even though you have a rechargeable unit, you would have to get a battery change before the 7-year or the 10-year mark, obviously. But he's telling me most of the time on those rechargeable ones, if they do require a battery change, they don't do that. They would just go ahead and give you a new device. And he said 99.9% insurance companies are okay with that anyway, because they're going to pay you for the procedure anyway. What else can I say? So hopefully, because here it is October 11th, the doctor's office said I should hear something by the end of the month. So I'm kind of maybe trying to plan this around doing like the week before Thanksgiving, so at least I can have 2 weeks off. So I take a week off for Thanksgiving. I think it's really, side note, I think it's really shitty for companies to make their employees work on on Thanksgiving and Christmas. I think it's really shitty if companies do that to employees, like grocery stores and Walmart and all them. Just shitty to employees. I think it should be against the law. Oh, they say, they volunteer to work. Bullshit. I know what goes on. They probably would said, if you don't show up, you'd be fired, basically. I think that's what happens. But watch the other video I'm going to be posting that has I'll show you the little kit they gave me. Also, I'm going to be attaching some pictures of what the device looks like when, because I took a picture at the doctor's office of a little, how they have like little models around, like the spine or whatever the case may be. So I took a picture of the little device and the little leads that they have on the little display, I guess, what you may want to call them. Uh, I do have to make a decision where they want to implant it. It can be in the upper back, by the hips. Um, Sometimes they will do it in the stomach area or in the butt cheeks. I kind of don't want that. I mean, it seems like to me they do implant it on one of your cheeks. It'd be kind of hard to sit down after the procedure. You know what I'm saying? Be sore for a week or two. Um, there's some risk involved in this. Could always be an infection. Um, Now, they did tell me that these devices, when in the hospital orders it gets billed from the hospital. I asked about that, and the actual hospital bills the insurance company for the device, not the manufacturer. And they did bill Blue Cross already. I think the device itself was $34,000. But like I said, it could be a risk of infection when they do an implantation. Now, when they do the implantation, that is actually done in an operating room under sterile environment versus a procedure room that's for back injections and things like that. When I had the trial done, the leads implanted, that was done in a procedure room because it was under X-ray and all of that. So like in layman's terms, hospitals have different levels of I guess sterilization, because that's a minor procedure room. They're not going to be cutting on skin. Mostly they're going to be inserting needles and things like that. And of course, the doctors in protective gowns and things like that, wearing rubber gloves, obviously, and like that. But since they're going to be cutting your skin and inserting a device, that has to be done in an operating room that's more sterile, obviously, because they're cutting up in your skin. And I forgot to ask him if they staple it, the incision, is it glued or is it stitched? I don't know. I have to ask them about that. I don't think they use staples anymore. I don't know if they do or not. Certainly, plastic surgeons do not use any kind of staples. I know that for sure because I asked them about that when I had my skin removed, excess skin. And you gotta be comfortable with your doctor. I am very, very comfortable with my doctor. I've been seeing him for 5 years. I followed him when he left his practice, and when he left Baylor, went on his own the other practice, Baylor Scott and White. So I did follow him, and he did tell me when he did that he was not able to call me because I guess when you leave a practice or the malpractice insurance stops, and he did tell me that. So he was upfront about that. He couldn't prescribe any medication, could not give me any medical advice or anything like that when he was transitioning. Because I guess his medical malpractice insurance was with Baylor Scott and White because it was under Baylor Scott and White's name underneath their provider part of it. So you got to be comfortable with your doctor who's doing this for you. If you have one of these doctors that you don't think they know what the hell they're talking about, or if you have a bad feeling in your gut, don't do it. Find another doctor who wants to do an implantation. That device is going to be in there for years on end, and you got to make sure it works right, not half-ass. You got to make sure they do it properly. You got to have confidence in your doctor and make sure he's going to do a good job in the operating room when they do implantation. I've never been in the operating room with my doctor, but I have been with him obviously lots of times in the procedure rooms. With I would say maybe 10 different times with different injections, and then a complication from that. So I do have confidence in him. And a couple of different times when I had injections done, I didn't have sedation. I was kind of drugged up. I was aware of what was going on. Um, and one injection he tried to do in my upper spine, and I think they call it thoracic. He did try, but he had to abort the procedure because he was not able to get the needle in the right place where he wants to inject the steroid in. And he was taking long, he was dragging on 45 minutes to an hour. So, he decided to just go ahead and stop, just abort the procedure. Because the longer you are drugged up and the longer you are under sedation, the more danger can occur. Now, obviously, maybe not really under light sedation. Now, general anesthetics, general anesthesia, the longer you're in that state, to my understanding, the danger level goes up and up. I mean, obviously, if you have 6-hour surgery, that's a high risk out there. So, oh, this video is almost 50 minutes long. 50 minutes long. So, to wrap it up, just have confidence in your doctor. And if you have a bad gut feeling about something, don't do it with them. Just do not go with them. And just like, my spine doctor, he said he does the trial part, but yet the pain management doctor does the implantation. Well, no, that doesn't fly in my book, really. I want one doctor that does it all. Around here, the spine doctors push everything off to the pain management doctor if it's non-surgical related, because the spine doctor does not do steroid injections or things like that. I don't know if they ever did or they just quit doing that. And just do your homework. Just do your homework and see if it's a good option for you. And this video is long enough, so I'll talk to you later. And stay tuned. I'm going to show you some pictures of the device. It's just a display thing.